Hi, my name is Lori Tamayo with LTCM, and I'm here to talk with you today about total case management. We provide a comprehensive case management solution from the emergency department all the way through to inpatient, swing bed, and then to the clinic components of a healthcare system. I'm here to visit with you about each component and explain the different aspects of this program. So the elements of the program are that we have case managers in the emergency department, case managers in the inpatient area, and we have case managers in the clinic. We have case management software, which is either Interqual or Milliman's, which is a recognized medical eligibility criteria used, and the software is interactive, which allows us to communicate with the providers and let them know things that might help a person qualify for observation, inpatient, or swing bed stays based on their documentation and the information that we have. It also allows us to help the provider make the decision to place an observation, place an inpatient, or place in swing bed. We have a lot of referral tracking materials and a lot of things that we utilize to show the practitioner the benefits for patients, assist the practitioner in facilitating next levels of care or continuation of the care for the patient. And we also utilize those to determine referral patterns and things that we can possibly do to improve patient care. So let's talk about each component, starting with the emergency room case management model. We generally staff that 10 to 12 hours a day with a case manager during your peak times, generally 10 to 10 or 11 to 11. That's generally when we see most ED volumes high. We look at what the patient's coming in for, and we get with the nurses and practitioners to be sure we know the different diagnoses and different treatments you're going to be doing so that we can then run it through the eligibility software and help determine where best the patient is placed. Our goal is to try to keep them in observation or inpatient if it's necessary, and if not, our goal is to discharge them but make sure that there are good follow-up appointments set up with their primary care providers and specialists, and that they also have suggestions for referral recommendations for different services that the hospital district or hospital system may utilize, and of course anything outside the system that the patient would need. By doing this, what we find is we take care of the entire patient. We make sure that they are looked at from a whole continuum of care, and that we're not just treating them and treating them for their acute need at the time, but let's figure out what's going on and try to solve all of their issues that we can through discharge planning and or inpatient care or swing bed care or whatever we can do to facilitate that patient have the best outcome. And what you find is that you see a reduction in returns within 72 hours, reduction in readmissions to the hospital, reduction in emergency room visits just in general. And basically you see that the patients are much healthier and they're much more satisfied. So by doing this in several different ways, of course, working up the patient and their needs while they're there, setting up anything if they're leaving so that they have good continuation of care, and then also always doing 24-hour post emergency room visit phone calls to ensure that the patient still is okay and to also make sure that they were satisfied. The other piece of this is making sure the case manager is always seeing the patient before discharge or before placement into the hospital to ensure that they understand everything that's going on from a layperson's perspective. This increases patient satisfaction significantly. Then we transition from the emergency room to the inpatient model. And the inpatient model looks at observation going to inpatient, inpatient going to swing bed for rehabilitation. And of course, we're managing that process throughout that patient's stay. The other piece we look at is if we do have to discharge to a higher level of care or transfer to a higher level of care, we are trying to call and check on those patients and their families, and we are making a liaison with the case manager in the higher level of care to ensure that those patients come back to us whenever it's time, whether it be in skilled nursing rehab, swing bed rehab, or if it's just, hey, let's make sure this patient comes back to our outpatient physical therapy because that's going to be their need. We want to be sure we're reaching out to every transfer so that we get the patient back into our system and they don't stay in the system of the higher level of care. The other piece, which is often a component but may not be in your health system, is the clinic component, and that is managing the patient in the clinic environment to where they have chronic care management, annual wellness visits. We're managing to make sure the referrals that go out to specialists, that those services that can come back to us from those specialists are coming back to us. So making sure we follow that patient as we're referring them out to make sure they come back in, and making sure the patients have everything they need by doing the chronic case management visits and by making sure that they come in for their annual wellness. So that's another component that ties in with each piece. So if you do have a long-term care component in your health system, then there is another program that we utilize to maximize that patient's needs and make sure that the patient is getting funneled back into the hospital system, the ancillary services that they offer, and that they are utilizing the clinic services that are available. Our goal is to work with the providers, the nurses, physicians, and all of the staff to help them take care of the patient, of course, the way we know that they want to take care of them. Not to question, not to tell them how to treat or what to do, but to just facilitate, give suggestions, and assist in any way we can to make sure that patient gets the best care possible, all their needs are met, and the health system definitely also gets utilized in the way that we want it to be utilized. Keep us from losing people to the higher level of cares or the larger cities for services that they can have here at home. We're facilitating all of that, trying to help with all of that, just so we can help you do your job the best way possible.